Aloha, Hawaii. It's time for the Vein Clinics of Hawaii radio show. Their team's approach to diagnosing problems and developing solutions and treatment plans are beyond compare. So let's get started with your host of the show, Mike Buck, and medical director, Dr. Randall Juliff of the Vein Clinics of Hawaii.
A very special treat for those of you today that are rejoining us, maybe from previous shows, or maybe this is the first time. Dr. Randall Juliff, like my friend just said, James, the medical director of Vein Clinics of Hawaii on 4 islands. And today here on Oahu, we're recording a program with actually one of Dr. Juliff's patients. We'll get into that because, as you know, if you were with us the last couple of times, we talked about various treatment procedures and things that are available, sort of the arsenal, if you will, that Doc has on untreated venous insufficiency and many of the other situations that he talks about. One of the things that I really am excited about today, Doc, is that it's always nice to walk in somebody's shoes and find out what somebody was thinking was going on in themselves. And almost every patient that I've ever met always wishes they'd have found this out a little bit earlier.
Yeah.
And isn't that the nature of the disease is? Before it really manifests in real bothersome symptoms, it sort of percolates under the skin for a long time.
Yeah, and especially with venous disease, because it comes on so slowly that people are able to kind of ignore the symptoms. But yeah, it's good to talk to real patients like James.
Yep.
And once we have a chance
we're going
to
to
do
call
that.
James because that's his name. Okay?
Yes.
It's an alias. It's not an alias. But I think it's interesting is that most of the time, Dr. Juliff and I have talked a lot about this, is that a lot of times, a lot of listeners think that venous insufficiency or veins or varicose veins are kind of a woman thing.
Right.
And
definitely not.
I'm not a woman, and I'm like a serious patient.
Yeah.
James is also a
James,
patient.
I noticed he's not a woman either.
Yeah, not at all. So I think maybe if you don't mind, James, let's share a little bit of your life and your health previously to walking in the Vein Clinics of Hawaii. We talked off the air quite a bit. You've always been a real active guy.
Pretty much.
Yeah, physically active, a busy guy.
Right. I did a career in the police department, and I at one time was an avid weightlifter. Not quite a bodybuilder.
Mm-hmm.
I've since built it more like Buddha, but
yeah. That's.
But I've
we
always
all
been
shift
somewhat
our
active.
priorities. But what I thought was interesting is that everything that you did was physically demanding.
Yes.
So, and yet you told me off the air that you never really looked at your veins. I mean,
Yeah, I
who
can't,
looks
looking down at my legs from my perspective. I don't see what other people see.
Mm-hmm.
So I don't see the profile vision of my legs, and I didn't realize that they were getting as dark as they were around the ankle area.
Okay, now, Doc, we've explained this, and I too have gone through the same thing, and almost all patients do. There are any number of things that cause that. So it's no wonder that James waited or didn't have this looked at for a while, because there's always some way to explain it.
Yeah, right. Yeah, there are different reasons why people might have discoloration of the lower leg. But that is one of those symptoms that if you have it, you very possibly might have venous insufficiency. But again, it's one of those symptoms that most people don't know. They have no idea that, gee, my skin is brown, maybe I've got bad veins. When people have varicose veins, it's easy. That's an easy symptom to connect with a vein issue. So those people don't have a problem connecting. But brownish discoloration of the skin of the lower leg, a very common symptom in vein disease. And we try to get that word out so that people know. Incidentally,
it's sort of interesting because James, you did just like me. This got. Were you a type 2 diabetic, or did you?
I am.
Yeah. So that's one of the things that happens to a diabetic, right? You have this thing. So you would, for probably a long time, just chalked it off to, as long as I'm watching my blood and everything, I'm going to be okay. That's my diabetes over there.
Right. But like I said, I didn't realize it was getting that bad.
Yeah.
But every time I saw it on someone else, I thought it was diabetes, and I thought it was, and it could be.
I'm like that. Doc's like that. We all walk. A guy's got diabetes.
But then later on, I learned that it was the staining of my skin from my insufficient veins, and that's the blood staining my skin because it's not going back where it's supposed to go.
What about symptoms? Any pain, tingling, heat, any of that stuff?
The symptoms that I experienced, my legs felt heavy, and
Doc, you hear that a lot, don't you?
Oh, yeah.
Heavy legs.
Very common.
The blood was pooling in my feet. My feet were swelling. And one of the different symptoms that I experienced is when I got up in the middle of the night, and I would void my bladder. And while I'm voiding, I would feel a tingling or a burning sensation all around my calves on both sides. And I didn't understand what that was. And so I figured there is a problem with my veins or my lower legs. I always was told that, you have poor circulation, because in the summer my feet were always cold.
Yeah.
And
in the summer.
Well, I used to run around barefoot in
Oh,
Ohio.
yeah.
And,
Of course. Yeah. I guess,
Okay.
and we think when they say cold in Ohio, Doc, they mean cold.
Yeah.
But interesting, because so how long would you say did you have that discoloration?
I would think between 3 to 5 years.
Yeah.
In the last 3 years, it started getting my attention, but I still didn't realize it was as dark as it was, because I'm looking at it from up here.
Sure.
And I'm not really looking at my leg in the mirror, so to speak.
So, Doc, what would have driven not just James but other patients into saying, okay, I think that's getting a little worse, and isn't it a matter of eliminating the symptom, or eliminating what causes the symptom? In other words, let's find the source of this stuff.
Yeah, well, sometimes you do have to. Sometimes it is a matter of ruling out a number of things until you get to the thing that really is causing the problem. James has had several steps along the way. There were sort of warning signs, kind of going out there. For instance, describe when you had the cellulitis. And that was a while before you presented to our office.
That's
even. And probably when you had that cellulitis, and I think most people know what cellulitis is. It's a infection of the skin, or inflammatory process in one way or another. And you were treated for it. It seemed to go away, and at that point, that probably, looking back, was related to your venous insufficiency and vein disease, but nobody really connected those dots for you.
Not at that point.
And of course, that's not something that the typical layperson would connect.
Right.
But how did that happen? How did that episode of cellulitis come on?
Well, I had a little cut on the back of my heel from where the screen door had smacked me on the way into the kitchen from the garage. And this was a couple of days before Christmas in 2015. And I was at Walmart, and I started feeling really nauseous. And so we went home, and I noticed that my leg was swelling up. And it looked a little dark, so I took some ibuprofen and went to sleep, and I woke up and I had a fever of 102. And because of the discoloration and the pain in my left leg, I thought I had a blood clot, because my mom had problems with blood clots. So I went to the emergency room because of that. Turned out I had cellulitis. My white cell count was up to almost 40,000.
Wow.
And I asked them, what should it normally be? They said, probably between 8 and 10,000.
Oh, boy.
And we're going to have to admit you. And I'm like, whoa, you're kidding me. And so they admitted me. They kept me in for a couple of days. And
during that time, what did they do to, first of all, ease your discomfort and to treat it?
Well, they gave me pain meds, but to treat it, they did an aggressive antibiotic, intravenous antibiotic for me.
Now, when looking back now, that was 3 years ago, basically, when you had that episode of cellulitis. Looking back now, do you remember having any of the other symptoms that you now recognize as being associated with venous insufficiency?
The pain sensation was pretty much very similar to the cellulitis. Not as severe, but similar. And when I went in the second time, I'm thinking, I have cellulitis again.
Here it comes again. Yeah.
Right.
Okay, that's pretty normal, isn't it, Doc?
Sure,
Yeah,
but
yeah.
when you said when you went in the second time, you mean when you went in the second time and found out that you had a blood clot? Is that what you mean?
That's correct. So
But what drove that? I mean, was it a regular visit to the doctor, or was it something that came up and he said, this isn't right, I got to go get it looked at right now?
Exactly.
Okay.
At that time, my foot was swelling up, and I had pain in my joint and my toe, and I'm thinking maybe this is gout or cellulitis again. And this time it actually turned out to be a blood clot. So they treated me for that. They put me on blood thinners and antibiotics, and after that calmed down, that was in April. When that calmed down, I saw that commercial because I work graveyard shift. I'm watching TV in the morning, and I saw the commercial, and I keep looking at that. I'm thinking, that sounds like what's happening to me. And I look at the skin ulcers. I'm not that far yet, but the darkening and the heavy legs, the swelling, the pain. So I said, I better get in there and find out what's going on. Let these guys look at my veins and let them tell me what's really happening.
Doc, let me ask you a question, because I remember a previous show, we did the 6 stages of venous disease, and it was to the benefit of every patient to find out where on that chart they are. And taking the first step, you might come in at a 6. Now you got problems. But if the earlier you come in at, so at what level, if our audience remembers the show that we did about that, was this sort of a median, middle level, or was this already getting to
middle to high? I mean, when we start to see skin changes, chronic skin changes, the darkening of the skin, the thickening of the skin, and various ways that it might break down. That's getting into the higher stages. There's no question about it, and which brings me back to the episode of cellulitis that you had. You mentioned that it was initiated or brought about by the fact that the door hit your ankle. You developed a little scratch.
Right.
Now, and this is something that we've talked about with respect to ulcer disease, in venous insufficiency. If you have an ulcer on your foot or ankle and it's not healing the way that you think it should, then that's a warning sign. Yeah. You need to look into it. Now, what happened to you was that you had a little scratch on your foot, and had your circulation been completely normal, you probably would have gone on to heal that over the course of the next, week or two. But, I feel that probably back then, now that was only 3 years ago, and again, venous insufficiency is something that comes on over years and years. I'm sure that you had some amount of venous insufficiency back then, and that's why that scratch didn't heal the way that it should have, and it turned into a huge infection. I mean, if you were in the hospital on IV antibiotics for a week,
2 days.
That's really serious.
That's
But you know what I think is kind of neat? At what point in time, did you start asking yourself the question, did you come from a family that had a history of varicose veins? I mean, did mom or dad, like my parents, my mom, so I just inherited. Thanks, Mom.
That's pretty much what was going on.
So you expected a little bit of it.
Right.
But maybe because of your strength and you're a tough guy, that it wasn't going to get you down. You were able to bear the pain and just go on with things.
Right.
But now when you went to the ER because of this big storm of pain going on in there, they dealt with it as it was a clot?
No, with the with the cellulitis. No, they dealt with it as a serious infection.
Okay.
It was actually into my lymph nodes, and that's why I was feeling pain all the way up in my groin area, and it was traveling very fast. As a matter of fact, my dentist had a friend that stumped her toe in the garage on Wednesday, and she was dead on Sunday, and she was dead on Wednesday from cellulitis.
Yeah, that's very scary. Yeah.
Travels that fast, and so that got my attention. And when I had the blood clot, and it was coming on again, I'm thinking, I better get in there and find out what's going on. Maybe it's a blood clot.
Now,
cellulitis. I'm sorry.
When you did go in for the cellulitis the first time, just as a point of interest, did they do an ultrasound just to make sure that you did not have a blood clot? Do you recall?
I don't recall.
Yeah.
When they told me my white cell count was up to 40,000, I don't remember much after that.
Yeah. I mean, chances are it was just the infection, but it would have been interesting to know whether you had it.
But
they may have done, and I just don't remember.
Yeah, and what I think is, out there, gang, if you want to go to veinclinicsofhawaii.com and sort of, drift around this subject, you can do that. You can learn an awful lot there. But I think the value of having the fact that James had a condition of venous insufficiency in his family and some of the symptoms he was able to bear, that it might have been very fortuitous that the straw that broke the camel's back was still short of being a real critical one. You got. It sounds like you reached out for help at the right time.
So now, between the time that you had your episode of cellulitis and then, I guess, 3 years later when you did develop the DVT, the blood clot, were you recognizing those kind of symptoms over that period, over those 3 years? So over those 3 years, you started to recognize, gee, my legs are feeling heavy, achy, throbbing, the tingling stuff that you noticed when you'd get up in the middle of the night.
Right.
Those were all happening and worsening, probably over that 3-year period.
Yes.
So then you have this next incident where you know something's going on, and you shoot into the hospital or wherever that was, and had the ultrasound, and they said, yeah, you have a DVT, and you get treated for it.
Yes. Was that immediate? I mean, was that an extension of the ER visit?
Yes. As a matter of fact, they put me on blood thinners. They gave me the ultrasound scan, and then I went back a week later for a follow-up, and it was definitely blood clot, but it had resolved itself, or it was in the process of resolving itself.
Doc, maybe you can explain how that does happen sometimes, that, not every clot is the DVT that you hear about when you watch the late-night television, and you better not get on an airplane because your life is in your own hands, but still, it can.
Oh yeah, there's varying extents of DVT, and it really is important because not only does it impact symptoms and the immediate treatment sometimes, but also the long-lasting downsides to blood clots that we see with very, very extensive blood clots. Now, when they're involving the entire leg, very likely your body probably won't be able to break down the entire clot. However, it sounds to me like, and as I recall, you had a blood clot that was probably a little lower in the leg, which is a good thing because over a relatively short period of time, your body was able to break that clot down, and then subsequently our ultrasounds, I know when you came into our office several months later, we didn't see it, so the clot had resolved. And, that's lucky because blood clot in and of itself can cause, major problems as the years go by. And blood clot also can interfere and alter the normal function of the deep veins, which can compound problems, especially in people who have superficial venous insufficiency, which is what we ultimately went on to treat in you.
Let me ask this. Were there times when you had what I sometimes call the yeah, but moment? In other words, your DVT manifested, you went and got treatment, they handled it, and so are you then becoming more aware, I'm going to keep a better look at this stuff. I'm going to concentrate on getting stuff fixed immediately I find something. In other words, I'm not going to ignore a symptom?
Well, it certainly got my attention, and it sort of put me in that mode because I think what's happening is a lot of us, in the beginning, we go into denial. It's probably just getting old, and...
Or mom had this.
Mom had this, exactly. Yeah. And I think we need to be a little bit more responsible for our own medical condition. We've become accustomed to relying on whatever information we're told without getting another opinion or without asking more questions. What does that really mean? And, how's that going to affect me later on? Sometimes we're just willing to just accept what we get in information-wise. And when I saw the commercial from the vein clinics of Hawaii, I knew that there's more information there that I need that I don't have because that looks like me. And so I went in and I thought, well, at least they can tell me either we can treat this or there's nothing for you to worry about, but at least I will know.
Yeah, so I mean, and I know, Doc, that there's any number of ways people find their way to your offices. I mean, whatever trips the trigger, this is a good thing.
Sure.
But there is, I guess, maybe so that you can explain all of this stuff that we've talked about up to this point was prior to your going to vein clinics of Hawaii.
Yes.
Okay. When did that happen?
I went in June of 2018.
Okay.
And I had my procedure in July. And since then, I've been telling everyone I knew about it. Because
Pied Piper of the vein clinic. Yeah.
Yes. And for a good reason, because I've gotten good results from it. And I always tell people, I was a police officer, and people used to ask me legal questions, and I say, you need an attorney.
Yeah.
And so with this, it's the same thing. When you need brain surgery, you don't go ask the dentist what I need. Yeah. You have to go to the right source. So I have problems with my veins, so I went to the vein clinic.
Yeah, well, and even in addition to that, James, I think you made an important point a little earlier. And that is that if you feel like there's something wrong, there probably is. And if you're not getting all the answers that you think you need to evaluate that problem and to get a real firm, answer that makes sense to you, then probably you're not getting the right answers, and you need to, like you said, you have to take. People do have to take a certain amount of responsibility for themselves to, kind of figure stuff out. Often it doesn't just come to you,
right?
And yeah, I think that's a good lesson for everybody to keep in mind that if you've got a gut feeling that something's wrong, you need to look into it until you get a good answer.
Yes.
I think, gang, in many respects, that's why most of us are looking for a primary care physician that's like a quarterback, and that's what happened in my case. I got immediately, referred to an expert, and I do know that. Since we're talking about it, Dr. Juliff, that there are, just like in James and me and everybody else, a lot of these symptoms are very similar, but a lot of them lead to different disease. So I'm interested for our listeners to find out how you went through that, diagnostic process to determine what was the condition that James was suffering for, and then what are we going to do to treat him?
Well, with James, it was fairly easy because, he had this episode of DVT. He had the, pretty common symptoms of venous insufficiency. Did you have some varicose veins?
I did.
Yeah,
we
had
we removed some varicose veins.
Yeah, some varicosities. So
if this was, I could show you pictures. I would. But he's like me. He had some goofy ugly things taken off.
So the picture all kind of fit. So it wasn't real hard. He was having symptoms in his legs. I mean, in a general sense, when somebody comes to us and they have pain or other symptoms in their legs, there's a number of things that we think of. It's either vascular, so it's either arterial or venous. Or it's a mechanical kind of problem with the musculoskeletal system, or it's a nerve problem, or other muscular kind of diseases. But most people come in, and just from their complaints and by looking at them, we have a pretty good idea. We and it's easy to find out whether it's arterial. I mean, we do a pretty quick exam, and most of the time you can figure that out. We knew with James it wasn't an arterial problem. But again, he had all this history. He had the family history. He had the DVT, the symptoms, and the varicose veins. So it all kind of fit together.
Yeah. One more question from me, James, because I think we all of us are similar in many respects. I remember my mom, who was, a businesswoman, a retail store owner, and on her legs as a model forever and ever, and had horrific vein issues and surgeries many, many times, to the point where I thought to myself, I'm never going to do that. Was there any of that episodic stuff that you can recall when you were younger of a parent or even grandparent going through painful procedures to work on their veins?
Oh, absolutely. Not necessarily working on the veins, but the suffering part. My mom, she grew up on a farm, 8th grade education, so she took various jobs where she was always on her feet, and she, for many years, she was a cook, and then
that's kind of interesting, right? Because we've explained some of the professions, not just dentists and hairdressers, but cooks and everybody that's in the kitchen is on their feet all day long.
Right. Yeah. And I experienced the same thing as a corrections officer, as a police officer. You spend hours sometimes at a time on your feet, and even to this day, my mom is 87, and sometimes her feet are so swollen. It looks like those feet don't belong on that body.
Is that right?
Whose feet are those? And
what does she do about that?
Well, she's just she went to see a doctor about it, and he doesn't want to put her through the surgery. So she said that he told her at her age he'd rather not put her through the surgery.
Are there things, doctor, that you would say? I do know that you'd probably argue with part of that, but I'm going to assume that if somebody is proactive and they know what they've got, at least some home remedies. The old elevation and compression socks and all those things might help. But
when all else fails, or when all else is not an option. I mean, compression stockings that people are able to incorporate into their day-to-day life and elevation are two great things for, swelling from whatever reason, but, venous insufficiency, very, very commonly one of them. But we also, depending on the general medical status of an 80-year-old lady, or even 90-year-old. I mean, we've treated 90-year-old patients. So if we feel that if they're medically fit otherwise, the procedures in general are so easy that they're very easily tolerated, and many people can get very good relief from them.
Yeah, I mean, for instance, was Mom at nighttime a leg elevator?
Well, she does elevator feed, and even when I was a kid, I remember the compression socks. They used to call them support hose.
Oh, yeah.
And so she used to wear support hose when she would go to work and things like that.
I'm guilty.
But she,
got to do it.
Yeah, I have compression socks. I wear them when I'm working. And she has other issues. My mom is obese, and I tell her sometimes she can't catch her breath. And I said, Mom, you need to lose a little weight. Yeah. And I know what I'm talking about because I need to lose a little weight. And I suffer that myself. And she finds ways to, well, the doctor needs to fix this.
Yeah, but Doc, isn't this atypical of people? I mean, that are suffering from a number of things. Right. And as long as you take and get proactive on one of them, it might affect some of the other stuff. Like if you need to lose some weight, but you can't walk because your legs hurt, and then you get your legs fixed, now you can walk and maybe lose some weight.
Absolutely.
Yeah, it's an increasing experience of life.
And we hear that all the time. Yeah. People come in and they say, gee, 4 years ago I was out jogging 3 miles and, doing this and that. And, because of my legs, I haven't been able to get to the gym or do anything active or even do the things that you want to do. I mean, correcting those kind of problems, not only is it a health issue, but a quality of life issue also.
Yeah, but so the other thing is, and I guess James, and it's really great and fortuitous that we have James here, and you can learn a lot of other stuff on veinclinicsofhawaii.com, and I'll tell you about that again a little later. But having this opportunity, because this strapping, alpha male, used to being up and strong and everything, you probably put up with it longer than somebody that had other conditions. What were your other conditions? You already said type 2 diabetes.
Type 2 diabetes. I'm somewhat obese. Yeah. I've got this friend that I carry around my waist every day.
He thinks he's obese. He's not really obese. He's just a big guy, big dude.
Yeah.
But anyway, so that was type 2 diabetes.
Right.
Did you ever work on that? As how do I get off this bandwagon?
Well, one I did, and I went through 2 different things. One of the things I did is after dinner, I would walk 2 miles a night, every night, and I lost about 30 pounds just from that. And there was another time when I just reduced my sugar intake, and I lost the weight from that. But now that I've gotten back to exercising that fork and chopsticks a lot, my doctor put me on metformin, and I was on that before. And
this is we're talking about your PC, your primary care,
right? Yeah. And I didn't like it because it gave me diarrhea, so I stopped taking it. And that's when I started the walking. And my doctor goes, "Hey, your numbers look good. What are you doing? Because you can tell me what you want, but your numbers don't lie." Yeah. And I told him I was eating better and I was walking. He said, "Well, I think I'm going to take you off of that metformin." And I said, "Good," because I took myself off about 6 months ago. Yeah.
But there's another thing, and I'm glad he brings that up, Doc, because we've talked on previous shows. At this point in time, there aren't no, here's a prescription, here's a pill. In other words, you need to be checked out on a regular basis. You need to be diagnosed, and you need ultrasound because it's hard to treat. I mean, I'm sure there's a lot of things down the pike. We talked about that on previous shows, but there's no magic pill yet.
There's no magic pill for venous insufficiency, because it's a mechanical problem, and it's just like stockings. I mean, compression stockings it's sort of a Band-Aid. It will, while you have them on, correct the symptoms or improve the symptoms, but it's not really fixing the problem of blood flow, abnormal blood flow in the veins, and which is essentially what we found. James came in, presented to the office, and we went through our usual, song and dance. Did our own ultrasound, and as it turned out, in addition to having this prior history of DVT and cellulitis, he also had something that we call venous insufficiency, which is a very, very common problem, which basically means that the blood flow in your vein, in some of the veins in the legs, is not going in the right direction.
When we talked earlier, though, James, you've had 2 procedures. Each leg.
Each leg.
And Doc, sometimes you said that sometimes you can have one leg that is not a problem and the other one's a problem. In this case, it was probably indicative that he had similar conditions on both legs.
He had very
pretty
equivalent,
equal.
pretty equivalent problems on both legs. But yeah, it's funny how that is. Where one leg will be further along in the timeline. Venous disease is something that just gets, progressively worse with time. Again, getting back to the magic pill. I mean, not only is there not a magic pill, but there's not an exercise or a diet or, some kind of lifestyle
we checked
change.
all those boxes. It's just not happening.
Yeah, it's not going to impact that significantly. So, it's a mechanical problem that needs a mechanical correction.
Okay, let's leap forward because I think that a number of you out there that, like James and me, have a history of venous insufficiency in our family, and so we inherit that. I mean, there's little you can do about it. However, I think that would be very interesting, and when we find out in a minute what particular treatment Doc decided would be the most valuable in your case. You've had two of these procedures.
Yes.
Were you surprised that you could walk in, have a procedure, and then walk out?
Well, I wasn't that surprised. I was surprised when I heard that information through the commercial that in some cases that actually happens.
Yeah.
And I went in, and when they told me we're going to proceed with the venous seal and we're going to do this, I was very pleased with that information, and I was even more pleased to walk out with just the Band-Aid.
Yeah.
That's a whole bunch different, and I'm sure your mom and her mom or whoever, they could have told you some pretty horrific things from before. Okay, so how did that? Now, when we talked about it, and this goes back to a previous program where we started one by one. We're gonna, when we can, incorporate a patient into our program, and then incorporate the method or the treatment that Dr. Julep decided to present to the patient. And talk it over and go ahead with that. So this venous seal is, for those that don't remember when we did that, is what?
The venous seal relies or utilizes a biologic glue. So it's sort of super glue.
The super glue for the legs.
Super glue that we shoot into the vein. So, the way that in a general term, the way that we treat venous insufficiency is to would do something called endovenous ablation, and basically that just means we're going to close that vein down. Now, why do we close the vein down? We close it down because the problem with the vein is that the one-way valves are failing, and the valves are so tiny. I mean, they're just little wisps of tissue. We really can't at this moment surgically correct that. So
someday there'll be a go to the shelf and grab a type O. Valve kit.
Yeah, sure.
But not for a while.
And just slip it in.
Yeah.
But, we don't have that now. So the all of the procedures that we have nowadays have taken over what we used to do, which is vein stripping, where we used to yank that vein right out of the leg. We don't do that anymore. The vein stays in the leg, and we stop, halt the function in one way or another. Now, prior to the last year and a half or so, or the last couple of years, we have had primarily heat-based devices that would close the vein.
Sure.
So whether we're using a laser or something called a radiofrequency catheter, we would advance that device into the vein, and once it was in position, then we'd activate the catheter, and the catheter heats up the inside. So closes the vein down, so we're sort of cauterizing the vein from the inside.
Okay, wait a minute. If you're listening to this, it's the way the doc has explained it, and he has on other shows, and I'm going to guess that James, same as me, was very inquisitive. It sounded like you having a full-on parking lot going on there. I mean, there's trucks and things drawing in and out. And in actual fact, what Doc is talking about is you have to do what he does, you have to, number one, have pretty good vision, because you're looking at some really small stuff, right?
Yeah.
So when he said that he walked out with a Band-Aid, that shows you. So in his case, when we talked at previous shows, Doc, can you explain, did you go from the top down to treat him, or did you go from the bottom up?
By and large, most of the time. Now, sometimes we start more, up higher and go down, but for the most part, we're starting lower and threading whatever it is we're using, the catheter or the device, from the lower part of the leg up toward the groin. or the end of the vein that we're working on. So we basically, when James came in, we gave him the option. How do you want to do this? Now there are some advantages to the VenaSeal device. There's advantages to each one, individual type of device. But do you remember us talking to you, James, about the options and what was going through your mind when we did that?
Yes. Actually, what was going through my mind is when it came to the heat ablation, the possibility that the tissue around that area could be damaged or sometimes may cause damage to the nerve. And the other one, not involving heat, we weren't looking at that option of having to deal with the damaged tissue. And that was appealing to me because I'm a crybaby.
Were you surprised that there were options?
I really was.
Yeah.
I really was.
I think a lot of people that listen don't understand. We talk about this. I can, right off the top of my head, remember 4 or 5 different ones and maybe uses of a combination. So this VenaSeal, the super glue thing, sounded pretty good to you.
Sounded really good to me.
Yeah.
So I chose the VenaSeal, and I was fortunate enough that I didn't have any problems. And in addition to that, we actually removed some varicose veins as well.
Yeah.
So I had 3 procedures on my left leg. They went in through the calf area, the front calf, and I think the thigh area.
Same time.
And then the back side of my calf. So, again, I walked out with a Band-Aid the first day that I had it. I actually went to work that night. It was tight.
Doc, I think that people need to know that, we talk about this. It's extremely demanding, intense micro work that you're doing. That, the equipment, the tools, the needles, the wires, the catheters, if you put a fistful of them in somebody's hand, they wouldn't know what they were. I mean, it would just be these little things. What was the decision-making process where you would think to have recommended to James or respond to his concerns about the heat, saying, okay, well, then we can do this? How do you pitch that, if you will?
Well, I think with that particular device, if we're trying to decide VenaSeal versus, a heat-based device, usually it's patient preference, which I think primarily it was for James. Yes. Now, there are situations where we might be working on a vein and the location of the vein or the anatomy is such that, that person might be at a little higher risk for nerve injury or skin injury or, surrounding tissue type problems if we use a heat-based device. So in those situations where their risk is too high, we might recommend to them strongly, hey, listen, let's do a non-thermal device rather than this because it's going to really be safer for you. For James, it was. I mean, the safety issues were there. I mean, if you're eliminating the heat, then there's, you're eliminating completely the risk of damage from the heat. But again, in most people, it's a patient preference. The other thing that people like about VenaSeal is that you don't have to wear compression stockings afterward, and like we do with all the heat-based devices. But and that's one of the really kind of impressive things about this VenaSeal device with the biologic glue. We watch. I mean, we can see it happening. We're watching it with the ultrasound machine while we're shooting the glue in, and I mean, it's nearly instantaneous that this glue sets up and the vein is closed, and boom, you're done.
Let me be devil's advocate for a minute, and let me ask you, James. Did you ask during this? Okay, this sounds like my cup of tea. This is what I want. But what are the side effects, or does it fail? I mean, how guaranteed is it that this particular glue stuff's going to work?
I don't think I asked that question. I think I was immediately sold just from the information.
Yeah, that's good. That's good. Well, so you were receptive to the information.
In addition to that, I'm a surgical chicken, and the thought of having my skin or nerves damaged by the heat didn't appeal to me.
But Doc, and I'm sure that this you've gone through volumes of stuff. And by the way, when this stuff finally works its way into the medical marketplace, and docs like Dr. Juleff and others that are staying in front of the trends, and as a matter of fact, sponges for knowledge of new treatments. Are there any contraindicatives on this stuff? I mean, can it fail?
Well, it can fail, but the success rate of VenaSeal is very similar to the success rate, the long-term success rate of the thermal devices. And yeah, of course, that has all been looked at. Now, that being said, however, the VenaSeal hasn't been around anywhere near as long as the radio frequency or laser endovenous ablation. But at least midterm kind of results are showing that they're very, very close, and all of them have a relatively high success rate, low failure rate. Yeah,
were you when you made that decision? Obviously, outside of the commercial and talking to the practitioner, talking to the doc and staff, this must have come as, hey, let's get rolling on this.
Let's get rolling.
How long was it between your one leg and then the other?
I did my left leg in July, and I believe the right leg was in September.
Okay, so that's a while, Doc. Is that recommended, or is it just a matter of the ability to the doctor and the patient to get together again, or what are some of the factors?
I think it would mainly just scheduling. But we very commonly do both legs over a relatively short period of time. Sure. And we always do one leg over a relatively short period of time. We like to get at least if there's a couple of different procedures we're doing, we like to get them over with on one leg over a few days.
Okay, let's get serious now, because obviously, James, you went in to get the second procedure because you were happy with the first one.
That's correct.
What symptoms either went away or certainly lessened?
My anxiety.
That's important. That's really important.
I was a little nervous about it, and it was actually comforting to see the procedure on the screen as they were running the catheter through.
Wow.
But and the only sensation I could feel was the sensation of something moving through.
Yeah.
Now on my right leg, I have some really tiny veins there, and they seem to react or shut down a little bit as the catheter was going through. A little bit of discomfort, but it wasn't that bad, because I already knew what the results were going to be. So
yeah, see, that's the key.
If I got to bite down on the bullet a little bit, I'm going to bite it, because the results are tremendous.
Yeah, but I find, Dr. Juleff, when you talk about a little poke, in comparison to the pokes that there used to be, it really is little.
Yeah.
Oh, yeah.
I mean, that must be the reason why you probably are, when you finally did get into the second leg, saying, hey, come on, let's go. Let's do this already. Yeah.
Well, James, the heaviness, the achiness, the tingling that you described before, have all of those for the most part gone away?
For the most part, they have. And the only time I feel it, I think I need to lower my bed, because I'm a short guy. So when I sit on the side of the bed, my feet doesn't touch the floor. And then if I stand
Isn't that
up,
funny? Everybody's building these high beds for a reason now.
Yeah.
I'm the same way. My bed, what is this thing so high for? Yeah.
I don't know.
Yeah.
So I feel a little bit of tingling in my lower legs if I hang off the side of the bed too long.
Did you, like me, have sometimes episodes in the night where you would wake up with a big cramp in your leg?
I never had cramps.
Never had that.
I always had the tingling of the pain.
Yeah.
And when I would stand up and my body weight would come down on it, then it felt painful.
Okay, so what have you done to remedy that, the height of the bed?
Well, it's still high, but we have an adjustable bed, so it's easy to put the feet up. And I do that as soon as sometimes if I get sidetracked by my phone, I'll find myself sitting on the side of the bed too long, and then I'll put my feet up or go to the zero gravity position.
The other issue for James is that he had this DVT, and people with venous insufficiency are at a little increased risk of developing a DVT, compared to people who don't have venous insufficiency. And correcting the venous insufficiency brings you back down to a level that is similar to the general population with respect to a risk for a DVT. So that's another reason, in addition to relieving symptoms, and treating the problems that you're having immediately, it's also eliminating that additional risk of DVT, which can be fatal sometimes.
Okay, let me ask first Doc a question, and then James, if you've experienced this. As a victim of a DVT, you already know that you run the risk of additional ones. And we talked about that a little bit, that having one, it's no guarantee you're going to get another, but it's more probable than not probable. Is it sometimes a good thing, Doc, to reduce, by treating other venous insufficiencies, to reduce the symptoms so that it is more clear to a patient when, hey, I might have a blood clot, or I better go get this little rascal looked at because something's going on here.
Yeah, that could be. Yeah. That would be a side benefit. Yeah. Sure, absolutely.
And what would that be? I mean,
getting rid of the symptoms that you were having, so that there's not so much question. If you do have a new symptom, there's not as much question in your mind that, gee, you need to look into it.
Yeah, I think that's fascinating, and maybe, because in the very beginning of the program, James said that he's like the Pied Piper of Vein Clinics of Hawaii because of his experience. I guess there's still sometimes, and you can take a horse to water, but you can't make them drink.
Right.
And I know, because I've got friends, and I'm sure that you have friends, you can see what's wrong with them.
Right.
And you can say, hey, what are you doing? This is so simple to fix. Do you feel that way sometimes? Hey, come on, man, wake up.
And you can't make them drink.
Yeah.
You can't.
Well,
but some of them can. As a matter of fact, there's a couple of coworkers that I've had that have made appointments with the vein clinic.
Well, what I'm worried about is, as we age, Dr. Juleff and I, we've talked about this before, and maybe James is a good example of this. As long as you got the strength and the energy, you want to keep doing stuff.
Exactly.
In your case, you're working on a third career. I mean, you just keep going and going and going.
Right.
But if you're not comfortable, if you're standing an 8-hour shift on your legs and your legs are on fire, you don't want to go to work the next day.
Right.
Did you ever have to stay home because of symptoms?
With a combination, not just the symptoms alone. I also have knee problems. So my job that I have now requires a lot of walking, and it's about 5.5 miles a night if I have that particular post, including stairs.
Oh boy.
Including about 700 stairs per night. So
you got to wear one of those Fitbits or whatever they are, Doc, right? Be the Pied Piper. But doesn't in many respects, this is his gig. That's what he's chosen to do. But isn't that good for a doc to hear that this guy, by virtue of what he does, has to keep moving?
Yeah.
And keep going.
Sure. With respect to what you said before, just maintaining good health so that you can stay active, et cetera. Most symptoms, and especially symptoms in our legs, most of the time it's not just because we're getting old. Most of the time there's a very possibly a medical problem that is causing that and needs to be looked into. But we hear that all the time. People, after we fix them and they feel better, they say, gee, my legs feel great. I thought I was just getting old, and that's why they felt so tired.
James, are there others like you? I mean, in other words, after being in law enforcement for the length of time you were in, retiring out and getting out, there are some people that work, in your case and in my case, because you want to. You can and you want to, and you feel good.
Right.
But what about people that need to, and because of venous insufficiency or other problems, they're not able to get to work? They do have to take 6 days off. They do have to call in sick and literally put their job on the line because they can't get to work and do the job.
Well, I've had that problem myself with the combination of the venous insufficiency and my knees. So if I have a long night with 5.5 miles with 700 stairs involved, and I may call in sick the next day because I'm
not going on a radio host day to spend with the worker, man. I'm not doing that. It sounds like you do a lot. But Doc, isn't that exactly why when you say, just because you're aging doesn't mean anything? These people that want to do something, be a greeter at a door or go to a supermarket and pass out samples, all the things that people do standing up all day in their 60s, 70s, and even later, it's because their circulation is not causing them.
Sure. Yeah.
That's pretty cool. All right. So, what's next? Where are you? You're in the monitoring stage?
Well, I'm in a monitoring stage, and one of the things I'm always touching the area where the glue is.
Yeah.
And
is it sticky?
No, it's not sticky, but it's starting to, the body's starting to absorb it because it feels like that. It used to feel like a straw. I'm like, man, what is that?
Yeah.
It's like a pipe in my leg, and it's getting smaller, so it's being absorbed by the body. I can feel it getting smaller. So
that's a good point.
Yeah, maybe you can expand on it a little bit. People, if you were with us last week, we discussed the same thing. These veins that are no longer stripped out, they're in there, but they're not as they don't maintain the same profile, and after a while, most of it somehow goes away. Explain that.
Yeah, well, because we render them, unuseful, inactive, and especially with the glue, where there's a little, it's inert. I mean, the body's not rejecting it in any sense, but because of that, your body's going to work to break down that vein and whatever's inside of it. So we see that we see that with all the procedures that we do. We close down a vein, and when we look at these veins over a long period of time, in a year or two, you don't see a vein anymore. All you do is see a little fibrotic thread going through your leg. But that the other thing that you mentioned, Mike, what now? And surveillance also is the key. With vein disease in the past, one of the things that we really fell short on was, watching people long term. And that's why, 20, 25 years ago, people went in, they had vein stripping, and
see in 10 years.
Yeah, exactly.
Whatever,
But because of that, you did see them in 10 years because they were going to come back with more problems. So James will be in 6 months for another ultrasound. We're going to take a look at everything, make sure that everything we did is still, status quo, make sure there's nothing new coming up. If there is, and sometimes there can be new little things that pop up because, venous insufficiency by and large is a genetic sort of problem. We're not changing your genes. We're just fixing what you have right now. And things come up, but we catch them early.
Yeah, and I still think, and that's a pretty good way to kind of wrap this one up, because what happened with James is he had the venous seal, which is one of the many arrows in the quiver. But obviously, that's not for everybody. And the other thing is that I guess you're going to be like me when you go in and get a checkup and say, I got a good report card. You know what I mean?
Right.
I mean, what I had done was the right thing, and right now there's nothing coming to take its place.
Right.
Did you ever think about, am I going to run out of some of these veins?
No.
Yeah.
No, I never did think about
Some people in the very beginning say, hey, wait a minute, you're stripping my veins, you're taking my veins out? What am I going to do?
Yeah.
You find out how neat the body is, right?
I think if it gets to that point, they'll have more they can put in.
Yeah. But I still think that it is a way. So the time spent and also not only with Dr. Juleff and the staff, but making sure that your insurance was taken care of and making sure that everything got followed up. That must be a big relief for somebody that really probably this could have been way worse.
Yes.
Right? That's something that I think we should reflect on, Dr. Juleff, that all of these things that we talk about could be way, way worse.
Oh, yeah. Yeah, sure. Yeah, especially, just going back to your episode of cellulitis.
Right.
I mean, you got treated quickly, which was key, but that could have turned into a much bigger deal. You had the DVT, that could have been much more extensive than what it was. Right. So, but you did the right thing. You acted. You saw something happening and you acted on it.
Yeah, and I think that therein lies one of the things that you said before. Was it one of the reasons why you didn't do anything is because you were in denial. I can handle this.
Put some dirt on it, shake it off.
Yeah, right? Exactly. I mean, that was what we all got told. Wasn't it? Get up. Yep. What do you mean? You don't have a concussion. Go play. Yep. Well, listen, it was great getting to know you a little bit. And who knows? You might bump into some of our listeners the next time you're down at the vein clinics getting take a look at it. James, thanks so much for
Thanks
joining
for having me. I appreciate it.
And Doc, next time we're gonna actually talk about a bunch of the myths that exist in venous insufficiency in the veins, right?
We're going to do some myth busting.
Dr. Juleff, the myth buster. That's on our next show. Thanks for listening. See you next time. In the meantime, check it out, veinclinicsofhawaii.com. Veinclinicsofhawaii.com. Have a safe and great week. We'll see you next time.
Well, that's our program for today, and we certainly hope you enjoyed meeting us. Please come back next week for our next episode. And in the meanwhile, to learn more, please visit our interactive website, veinclinicsofhawaii.com. That's veinclinicsofhawaii.com.